So we'll be looking at the measurement of a JVP and the significance of it. So before that, we'll go to a diagram to briefly visualize the theory so that during examination we actually understand what's happening. So what do you understand from this diagram?
So this diagram, doctor, it's basically the hepatojugular reflux diagram, and basically this is an examination in which we perform to basically if there's any indication of increased pressure in the right atrium. So as you can see the visualization, this is the internal jugular vein. Sorry, I think
this is the internal jugular vein.
Yes, this is the internal jugular vein. This is the right atrium, and then actually it connects with the superior vena cava, and then it will come down from the right atrium to the inferior vena cava. Hence, it will connect into the liver via the hepatic vein. So basically, what we do in the hepatojugular reflux is when we apply pressure, there will be a backflow of blood. When there's already an increased pressure, there will be a backflow, and then we'll have a pulsation that would be more than 1 minute for it to go back in. So that's the basic.
Let's simplify. So from what I can visualize.
Okay.
So this vein will be visible around the neck because I assume that this is the heart.
Yes.
And if this is extending away from the atrium, so it will be visible around the neck.
Okay.
So you're just looking at the distension or the bulging of a neck, similar to like if you have a pot filled with, let's say a cup filled with drink,
Yes.
and you squeeze it, you will get the backflow from the straw and everything will leave. The straw will bulge.
Understand.
So that's what I understand. And similarly, so this is just a long tube which is just linear, it's just connecting without any valves.
Without any valves, yes.
So when you give a push here, you are aggravating the already increased
Pressure in the
right
singular
atrium.
singular
Okay.
tube.
So what can increase the pressure in the right atrium?
Some conditions like copulmonal, doctor, which also means right-sided heart failure, and also sometimes I think pulmonary embolism also could be secondary to right bundle branch block, and hence increasing the pressure in the right.
Simpler complications.
Like right-sided heart failure.
Yeah, okay. Yeah, heart failure. So meaning that blood cannot leave this the
Yes.
aorta, right? So it cannot leave the heart.
Yes.
So it accumulates within the heart and it will
Increase the pressure.
pressure of the okay. That
Yes.
makes sense. So with the same pathology, you can think about other complications, other diagnoses.
Understood.
Okay. Then what is this?
Oh, I think that is basically how we differentiate between the pulsation of the internal jugular vein and also the carotid artery.
So you're telling me there's more tubes other than the internal jugular
Yes,
vein?
definitely,
Okay.
because there's the sternocleidomastoid has two heads, and then I think anterior to that lies the carotid artery, and lateral to that lies the internal jugular vein.
Right. Okay, so it's just a way to make sure that you're looking at the right tube.
Yes, correct.
And not a tube which we refers to
You are
artery.
right, Doctor.
So how do we actually differentiate?
I mean, basically it's simple. Vein has two pulsations, and artery has just one.
Okay, right. So and I think you would have done in the section or you would have seen vein and artery. So how does a vein differ from an artery from the cadavers that you see?
I think one is thicker and one is thinner. The muscular layer, the vein, and like what you mentioned, one can be included, one cannot be included.
Okay. So basically, an artery is more stretchy, bouncy,
Elastic.
whereas a vein is almost collapsed.
Correct.
Right.
Correct. That's right.
So how will we apply this theory into an examination? So we will be looking at that.
Sure.
What's the first step?
So first, we have to make sure the patient is lying at a 45-degree angle, so
Right.
that we can have the best view and be able to get the best results.
And good light exposure.
Correct. Yes, doctor.
Right, preferably sunlight.
Okay.
Good light exposure.
Okay.
And should I rotate his cervical spine in any direction?
Yes, doctor. Because since we are examining from the right,
Yeah.
I think it's best that we tilt the head to the
Okay.
left, so that we can get the proper exposure of the sternocleidomastoid.
Okay, the books will talk about two heads of the muscles,
Yes,
but I don't. Where are these? So I can see something here. So where exactly does the internal jugular vein lie?
So basically, to make things easier, can we just say that the internal jugular vein lies in between of the two heads?
Okay, where can you like?
Okay, so since this is like what you mentioned, the sternal head, and this would be the clavicular head, so I can estimate that the IJC lies somewhere in between here.
Okay, like a triangle.
Yes, you're right,
Okay.
doctor.
So okay, between this, okay, that I get a picture. Okay. Okay, yes. So I can see something Some pulsation. So is that the JVP that we're talking about?
Yes, doctor. Because like what we mentioned, the carotid pulse is palpable and the JVC is not palpable.
So how do I know this is not a carotid pulse, and how do I know if this is the internal jugular?
First, we start by the location. If it was a carotid pulse, then it will have to be above the sternal head. Carotid usually lies here, and the the internal jugular vein lies posterior to the sternal head of the sternocleidomastoid. So one would be the location, and
so basically the internal jugular vein is lateral to the carotid
that's
artery.
right. You're right. Yes,
right.
doctor.
And next.
Next, I think the vein has two pulsations, like what we mentioned on the waveform on the whiteboard just now, and the artery has only one pulsation.
Okay. One pulsation means you mean the vein comes
yes,
like that.
yes,
okay.
correct.
And the artery will be just
That's
okay. So this is
yeah.
Okay. Then
So
what are the changes?
So if let's see, when we mentioned about the hepatojugular reflux just now, so what we do is we apply a gentle pressure in the abdomen region, also known as the abdominojugular reflux. So when we apply gentle pressure, if let's say there were any right atrial hypertrophy, then the pulsation will last for about 1 minute before it goes back in. So that indicates a pathology in the right atrial. So that's the reason why we do the hepatojugular reflux and also.
Okay. And any other way to differentiate internal jugular vein from carotid artery? Okay, maybe with something with palpation or occlusion?
Not that I can think of, doctor.
Okay. So one thing is the internal jugular vein will be palpable, and you can occlude it.
Okay.
Yes, you can occlude it. So for example, here I can occlude it.
I understand.
Okay, and it will be not palpable.
But in the case of carotid,
yes. So not palpable means I can't feel a pulse. I can't palpate the pulse.
Okay, I understand.
Like carotid pulse, I can feel the pulsation.
Okay, I understand. Right? Let me just get a try. Yes.
So you can measure the heart rate with that.
Okay, I understand.
So here you can't.
Okay, I understood.
Okay. So number one, look if they are palpable, if you can occlude them, and their location.
Okay, understand.
Okay. So how do we measure the?
So first we have to look for the highest point of pulsation, and then we would mark the highest point of pulsation, and then we'll move right to the angle of Lewis, and from then we measure.
Right. Okay.
Okay,
So where will we mark the highest point?
Okay, let's see. The highest point of pulsation is somewhere out here. So I'm just gonna put a small mark here.
Okay.
Just gonna put a small mark here.
Okay, then
slightly bigger. Okay.
Picture in the tattoo.
Okay, I'm just gonna put a mark there, and then from there I would ideally want to put it on the angle of Lewis. And then okay, and then from there I would want Yep, so it's about 4.5.
So where do you measure? Is it so you placed, I could see that you placed two rulers like this. So where's the reading? Where's the 4.5?
Okay, so
here, is it?
Yep, from this highest point we would go and measure.
So you're measuring this?
Yes,
line.
it has to be perpendicular to the this measurement has to be perpendicular to the angle of Lewis. So from there I got about 4. Can we just roughly estimate that this is 4.5?
Okay.
So not only that, every time we have a reading we have to add 5 cm to the reading.
Okay.
So it will be about 4.5 we have to add about 5 cm, so it will be 9.5 something.
Why 5 cm?
The reason being, it has a theoretical aspect to that, because the heart lies 5 cm posterior to the chest wall, the angle of Lewis.
Okay, from which?
Yes, from which the angle of Lewis is located.
So by theory, let's say we are not putting him on 45. Okay, let's say let's say he is sitting like this.
Okay.
So let's say in any angle. So ideally 45 degrees, right?
Okay.
So do we measure it like, do we place a ruler like this or like this?
So basically, it has to be 90 degrees from the angle of Lewis. I think, if I'm not mistaken, it should be right like this, doctor.
Okay, that's the common mistake they do.
Yeah.
So it has to be always vertical to the angle of Lewis. So by theory, let's say just for a figure of speech, let's say I put him high. Okay. So I won't put my ruler like this. This is a common mistake people do. It will be still vertical.
Yeah.
So you need to form a 90 degrees. So it has to be always a 90 degree.
Okay.
This must be a 90 degree. So if you put it like this, it's not a 90 degree
Yeah.
anymore, right? So regardless of how he stands, this has to be always like this.
Okay.
It doesn't need to rest on his chest. This must be vertical. So as I said, even if he is like this, it will still be like this. It will still go like this. It will still go like this.
Okay.
You don't make it like this. It will still, even if he's 90 degrees up, it will still be vertical.
Okay.
So it has to be like this, vertical, and this will be direct to the ground. So the ground is 180 degrees. So put it directly to the ground. This is how you do it.
Okay.
So this, make sure it gets a 90 degrees. So the important common mistake people do is they put it flat on the chest. It has to be vertical. So even if it's 45, yes, you do it 45, but to get a better picture, even if he's at a different angle, it should never be like this. It should always be like this.
I understand. Okay.
It should be like this, vertical, not in contact with the chest.
Understand,
Vertical, right? And so it should be like this
I understand.
only, like this. So even if it's lying flat, it's still like this. Okay.
So I have a question for you, doctor. Because each time we measure, we would usually say the reading by we will tell the reading by it's 4.5 cm H2O. So if some students would also prefer to use 9 cm, 8 cm above the angle of Lewis. So what is the reasoning behind the H2O?
In the mercury, H is hydro, right? Okay, mercury is name. So what do we mean at sea level? Let's say you put a tube here, a cylinder here, okay, filled with mercury. This is what H is. Okay. Let's say this is you have some device to pump in pressure.
Okay.
So when you put pressure, this will rise, right?
Okay.
So to give the value of the pressure is indicated by how much the mercury rises.
Okay.
So the mercury rises by 15 millimeters. It is usually, okay, then the pressure is 15 mm Hg.
Okay.
So it gives an estimate about how much, and usually when you use mercury, the reading will be in millimeter because mercury is what? Is it dense or less dense?
Then,
Yeah, it's heavy, it's very heavy, right?
yeah.
So usually you will get, but see, this mercury it can be replaced with any fluid. Any fluid. You can even put water, 50 millimeter, what other fluid can you think of? Blood, probably.
Water?
So when you apply the same thing, when we say cm water, means just imagine at sea level, you have a tube filled with water. How much of pressure do you need to move the water by, let's say 10 cm? So let's say the amount of pressure in the JVP that you observe in the JVP is enough to move the water by 10 centimeters off its level. So it's 10 centimeter water. So this can be substituted. It can be mercury, it can be water, it could be any fluid.
Okay, understood. Okay.
So that's the idea.
I hope he understood how to measure JVP. Okay. Thank you so much, doctor.
Thank you.